today's topic is all about proper usage of trigger point balls. Now, the pelvic floor muscles are rarely tight in isolation. Very often there's concomitant hip tightness or abdominal tightness or low back tightness. As a holistic provider, I like to address a person in their entirety and not just treat the pelvic floor, because the pelvic floor is really only one piece of the puzzle. If there's tightness in the regional hip musculature, then it's going to be feeding into tightness in the pelvic floor. And to really address the whole person, we need to address both the pelvic floor and the hip tightness. So any patient who comes to see me not only has a pelvic floor assessment, but I also assess the hips, the abdomen, the low back, and determine which regional muscle groups are tight and possibly require hip to be stretched as well. And whenever I prescribe home stretches for people, I also teach them how to use a trigger point ball in advance as a way to loosen the muscles before stretching. I always tell my patients that they're going to get more bang for their buck out of their home stretching program if they first loosen the muscles or warmed up the muscle, so to speak, and then perform their stretches. They're going to have a longer lasting, better effect on loosening the tight structures in the muscles. So I teach patients how to use trigger point balls. It's actually the swag gift that I give all my patients at their initial evaluation. And I'm going to demonstrate in a separate video how you can use a trigger point ball, or the equivalent would be a Spalding ball or a pinky ball. You want it to be a firm ball, not like a soft material, because then it's not going to be as effective and efficient in rolling out or loosening the muscles. But before we do that in another video, I just want to explain that there's a progression as well in terms of self-massage work, loosening up the muscles. I always encourage patients to first use a trigger point ball because they can have more control over it and you can really fine-tune the areas that you want to work. And when that is no longer feeling as challenging as it had been when initially started, then I'll encourage patients to progress up onto a massage stick. And that could be ordered on Amazon. It basically looks like a rolling pin with beads on it. And that can be used to loosen up the muscles before performing stretches. And the third and final level of challenge in terms of self-muscle release work is using a foam roller, which is generally a little more intense than the ball or the stick, but can really provide a lot of benefit to patients.